Joining us this evening. We're very excited to host the student panel on career development and health equity. My name is Meghana Vijay Simha. I'm the current Vice President of Delta Omega Chapter at GW Milken Institute School of Public Health. So a little bit information about Delta Omega. It's the Honorary Society for Graduate Studies in Public Health, and the society was founded in 1924 and includes 58 chapters throughout the United States and Puerto Rico. The George Washington University's Omega chapter was established in 1995, and we have inducted nearly 500 members since then. We engage our membership in the community through networking events, community service activities, speakers events, and career panels similar to today. And each spring we induct new members into our group, which includes baccalaureate students pursuing public health degrees, master's students, doctoral students, alumni, who received a master's or doctorate degree from Milken Institute, and faculty at the Milken Institute School of Public Health. We'll be sending out information through the school and posting in our social media accounts with more information on the application process in the coming weeks for this spring. And you can also reach out to us via email with any questions. So now I'd like to introduce our speakers for today's events. Shawn Chiang is a Ph.D. student at Drexel University Dornsife School of Public Health and is currently serving as the Director of Member Engagement on our Delta Omega Chapter Board. Jennifer Maizel is a Ph.D. student at the University of Florida College of Public Health and Health Professions and is currently President of the Delta Omega Chapter. Munjireen Sifat is a PhD candidate at University of Maryland School of Public Health and also currently serves on the Delta Omega Chapter Board as past president. And finally, Ans Irfan is a Drph candidate at the George Washington University Milken School of Public Health. So I will ask a few questions and moderate today's event, and we can start by having each speaker welcome themselves and introduce themselves and tell us a little bit about your education and career experience.
Well, hi everyone, I'll start. So my name is Jennifer Maizel, as Meghana already said. I'm the current president of DO, and I'm really excited for you all to be here today and really appreciate you taking time out of your busy schedules to join us. I am, as Meghana said, a PhD student at the University of Florida, studying public health with a concentration in social and behavioral sciences. I am in my second semester of the program, so I actually started my PhD during the COVID-19 pandemic, which was a really challenging but interesting time to say the least. But I can't complain about being in Florida right now. It's actually 84 degrees and sunny today. But I have a MPH in health promotion from GW, a Bachelor of Science in Psychology from George Mason University. I'm also a certified health education specialist. And prior to starting my PhD, I worked at the American Diabetes Association, as well as interned with the Juvenile Diabetes Research Foundation.
And then I can go next. Hi, everyone. I'm Munjireen. So I got my bachelor's in neuroscience psychology at Penn State University. I got my MPH also in health promotion at GW, and I'm currently in the PhD program at the University of Maryland in the Behavioral and Community Health Department. And so I tend to focus on global mental health. So for my dissertation, I'm looking at the acceptability of using digital health and mHealth for mental health promotion. So like using mindfulness activities in university students in Bangladesh, where there's a high evidence of suicide rate. And I'm really, my passion, I would say, and what I want to do in the future is work in that same arena of mental health promotion, but with displaced populations and people in vulnerable settings. And so far, most of my work that I've done has been in academics. I'm currently at the Counseling Center within the research unit at UMD. And we actually work hand in hand with student affairs. So it's really great because you can see our research findings like almost immediately being implemented in the terms of policy or something like that on campus. And For example, we had a recent study about food security where we actually didn't realize that how many of our students were food insecure. And we wrote a grant and got funding and now have a campus pantry that's helped like hundreds of students. So that's really amazing. I've also worked with some other orgs consulting like International Rescue Committee and Sesame Workshop.
So I can go next. So hi, everyone. It's very nice to see everyone and joining us today. My name is Shawn Chiang. I got my bachelor's in biochemistry from UC San Diego. And then I moved on to get my MPH in public health communications and marketing back in 2017 at GW. And throughout the time, like, both at GW and also post-graduation, I supported a number of research projects in the area of cancer prevention and health informatics. And I also did health communication consulting on the side, and that's actually something I'm still doing nowadays. And I also got to work at the CDC for 2 years before I was like, hey, it's time to go back to school and get my PhD. So now I'm a second year PhD student at the Department of Community Health and Prevention at Drexel University. And my research largely focuses on the intersection between public health, communication science, and big data. And I'm happy to talk about more later.
Hi, everyone. Welcome. My name is Ans. I am a physician by training, and I half jokingly tell people that I went to med school because I'm brown and my parents made me so. But medical school was not something I was ever interested in. So at some point I discovered public health and I walked into it. But a little bit of my background really is, it's mostly in global health, predominantly in Pakistan and China. So I've had a chance to work in China during my medical school for about 4 to 5 years with historically marginalized populations. And then in the United States as well, most of my work has been in non-governmental sector with nonprofits, including consulting. But the crux of it really is, my interest is how do you get methodologies and disciplines from a number of different fields, put them together, and then propose more innovative interdisciplinary solutions, policy or programmatic. I also have a Doctor of Education, and I am currently working on my third one, Doctor of Public Health here at George Washington University at the moment.
Thanks, everyone. I forgot to mention earlier that if you have any questions for the speakers, feel free to add it into the group chat, and in the second half, we'll be going through those questions from the attendees. So my next question is, what did you study at GW and why did you choose to pursue a terminal degree?
So for me, I pursued a Master of Public Health in Health Promotion at GW, and I really, really enjoyed the program and found it to be quite helpful for the work experience that I did in the nonprofit sector. The Health Promotion program, teaches a lot about program design and evaluation, communication strategies, and social behavioral research methodologies. And so that was really key in the community-based work that I was doing with the American Diabetes Association. And I really enjoyed that work as well. But over time, when I was at ADA and just in my personal experience as well, I realized that there were many gaps in diabetes research in particular that I wanted to pursue further, more in an academic research setting. And so I decided to transition from nonprofit work to academia. And I felt like the best way for me to do that would be through getting a PhD degree. And I'm just really passionate about the research in that area in particular. I do live with type 1 diabetes myself, so I am really interested in also applying the lived experience aspect of it to the research that I'm doing. And I think that's something that is sometimes missing in health research as well. So I'm excited to do that more in the PhD as well.
And I was also in the health promotion department, prevention community health, same as Jennifer. And I started very broadly when I entered the MPH with health promotion. I thought it was all encompassing and I wasn't really sure. I didn't have a disease or health outcome of interest. I was thinking very broadly chronic disease or maybe WASH. But ultimately, I felt throughout my MPH, I learned a lot of practice-oriented things. But I really, really liked my evaluation course the most, where we didn't actually do any data analysis. So I felt like I had a lot of broad skills in I knew a little bit of how to evaluate, how to analyze, but very broadly. And I wanted to delve deeper and actually get those research methodology skills, actually do my own analysis and be comfortable doing that as like the lead on a project. And so that essentially led me to applying to PhD programs to broaden my methodology skills.
Very cool. Ans, do you want to go first?
Yeah, please. Go ahead.
Okay. I mean, like I said, I mean, I got my, when I was at GW, I got my MPH in public health communications and marketing. And actually, when I was in undergrad, I also have a minor in business with a focus on marketing as well. And I think it was one of the area where, you know, like when you start in business, like marketing from like a business perspective, and then that was like very different. Like, you know, you're really trying to like find ways to motivate people to like persuade them to purchase something. And when I got to GW, it was like, you know, I would like that switch kind of happened when, you know, when I got, you know, exposed to the idea of, you know, social marketing and how to really combine business principles to then apply in a health setting. So that was, but that said, I mean, there are many different ways that I think that influenced me that eventually to pursue PhD. So one of the many things that really influenced me, I think it was just kind of like my own background as an immigrant. I think there is this sort of expectation for me to go get a doctoral degree, whatever that may be in, but then also that's kind of like expectation that I have for myself. But more than that, like, you know, throughout my time at GW, I really got to participate in some of those research and really see how social marketing play out in real world settings. I had the honor to, you know, do research with Dr. Lorian Abrams at GW throughout my time there. And actually also after I graduated, I worked full-time for a while as well. And there, you know, I really see how research can be used as a way to, you know, advance health equity, to, you know, use research as a way to understand, to not only, you know, understand to systematically understand like what are those, you know, different pieces that's missing that needs to be addressed, but then on the flip side, you know, use the theories that we learn about and integrate different areas to then influence those changes to happen. And I think that's what was really cool about public health research for me, and why I eventually decided to pursue my PhD, to bend those methodologies to then be systematically address those issues that we see.
For me, so it was I believe it was 2017. I was already teaching as a faculty member at GW. And I had my somewhat smaller but limited amount of research portfolio as well at the time. But I knew that I did not want to do that research tenure track faculty thing because I just have way too many interests, and academia is very restrictive in that regard. So I had consulted for a local health department for a different particular project on their food inspections related stuff, because my background is in environmental and occupational health and climate change. They were looking for a deputy public health director's position. So they reached out to me if I would be interested in pursuing that particular thing. But when I went through the details of it, there was so much that an MD and MPH together doesn't give you. Like human resource management, financial management, budgeting, all the higher order leadership skills, your policy development, program development, implementation, and everything else in between. So that was my primary reason of going back to getting another terminal degree, because I think like we just need to be, generally academia is like fairly narcissistic, where they just tell you that just because you have some form of terminal degree, you know it all, and you don't. You have a limited amount of sort of like understanding of whatever you know. So that was sort of like, you know, my primary reason of going back and honing some of those advanced level leadership and management skills.
Great. Maybe this question is for Ans and maybe Shawn. Can you tell us the difference between the Doctor of Public Health and PhD degrees and why you chose to pursue one over the other? And then a second part of that question, one of the audience members of the audience asked, or attendees asked, do you recommend a PhD or a Doctor of PhD or Doctor of Public Health for someone with significant work experience, like one or the other?
Yeah, so DRPH, so the degree itself was conceived about 100 years ago in 1920s. And the problem at that time really was that most of the public health was being done by physicians, MDs. And there was this acknowledgement that medical school doesn't teach you virtually anything about public health whatsoever. But just because we have this like, you know, social banality of giving so much prestige to MDs, we just keep perpetuating it. Unfortunately, 100 years later, even in 2020, where you see these physicians running public health response and they have no understanding of public health principles. So the idea there really was that how can we use the MD model, which is really that you train people on a variety of very broad set of skill set, so they can go in and become the change makers and problem solvers. So that's sort of like is the idea for DRPH specifically, that it's applied, it's practice-based. The expectation is that you're gonna go and run something. Now people do go into academia and they teach, and the part of your training also focuses on pedagogical methods. But the primary career outcomes that you have in mind with the DRPH are leadership and management level positions. So you're running an agency and so on and so forth, a nonprofit, international response, and everything else in between. Versus a PhD is exponentially more narrow, that you're gonna get, you get to be an expert on how that one particle impacts that one cell in your left lung. So that's the sort of like, you know, it's a very narrow, very methodologically rigorous and, you know, heavy on methodology, but less so on applied side of skills. So that sort of like is the main distinction, I would say. And I'm happy to sort of like answer any follow-up questions and further explore that part. And as far as the experience part comes in, by the time I started my DRPH, I too had about like more or less a decade of experience at that particular point. But I think like one way of thinking about that would be your career outcomes. Like what kind of work do you want to do, right? Like, you know, what is it that makes you happy about that part? Like, I know that I cannot sit behind a screen and crunch numbers. Like, just no. Like, so it's important to know what is it that makes you happy and what is it that you cannot stand, right? So in that, so thinking about those career outcomes, like if it is more applied, hands-on stuff, then a DRPH would be a much better choice as opposed to a PhD. Versus like, you know, if your interest is in research, and then, you know, PhD is a fantastic choice too. But I'll let Shawn, Munj, or Jennifer comment on it further.
I mean, those are very good points, Ans. I mean, I think I will just add on and say that for me personally, I mean, I did ask myself those types of questions, you know, when I was applying, you know, whether I should go for DRPH, is that the right move for me? Am I really more interested in a PhD? But what I would say from my perspective, and people can disagree, is that, you know, I think for me, I mean, I would actually encourage everyone to, you know, just go to the school website and check out what their program is like, because I mean, I do believe there are DRPH program out there that's really structured more like a PhD program than like a DRPH program by how Ans describes it. And so, and in thinking and going back, and I definitely echoes that point, which, you know, in thinking, going back and think about like, you know, what you want to do after you get your degree, and really look at the curriculum that the degree offers, whether it's DRPH or PhD. I mean, for me, at the end of the day, it doesn't make that difference for me, but what you get out of it, because I do believe you can still serve in management role with a PhD. You can serve in a management role with a DRPH. No one's gonna tell you no, I feel like. But so yeah, so I mean, I would definitely encourage people to just go on, check out what it is that the school is offering and what type of skills, whether it's topical, whether it's methodological, whether it's leadership and practical experiences. Think about the different pieces, and if you have a lot of experience already, then then maybe you're more interested in some of those methodological skills that maybe you have not been exposed to. And then you can look for school that maybe better fit your needs. And and there are some schools out there that nowadays do allow a part-time PhD. So most of the school do kind of like require you to do your PhD full-time, but I do know there's some schools now that also offer that option. So yeah, so I'll definitely check that out. I think anyone else can add on.
Yeah, I wanted to say that funding was a big thing for me when I was looking at programs, because at this point I had done undergrad and my master's and I didn't want to have more debt. And it was harder for me. So I looked at both DRPH and PhD programs because I think, like Shawn and Ans said, there are lots of transferable skills that you can get from both of them. And I was more unsuccessful finding funding for the DRPH programs. And ultimately, one of my deciding factors on where to go was the amount of funding and how much cost of living was in that area. So I ultimately ended up going with the PhD for those reasons. And just to echo what Shawn said, looking at the coursework of the different programs that you're interested in was one thing that I did to help decide which program I wanted to go to.
And I just wanted to echo like everything that everyone just said about this. This was a significant internal debate for me about whether to get a PhD or DRPH, and actually applied to both before I decided to attend a PhD program. And I had been working full-time in the field. I had about 6 years of experience, and some of my earlier mentors had told me that because of that work experience, I could really keep building on that and do a DRPH, leadership oriented degree. But for me, I really was thinking about what I wanted to do. And it was really, I wanted to build my research portfolio. I wanted to collaborate with other researchers who shared my interests. And so that ended up ultimately pushing me to get a PhD. But, funding was also another consideration, as was mentorship and, overall, the overall long-term goal that I wanted to achieve, which was to conduct research.
Awesome. So next question is, what are your public health research and practice interests, and what are you currently working on?
So for me, my interests primarily relate to diabetes, with emphases on the psychosocial aspects of having that condition and other complications or comorbidities associated with that. From my own experience living with diabetes and working with communities, particularly underserved communities, there are a lot of psychological and social barriers to achieving ideal or optimal diabetes management regimens and stuff like that. And so I really wanted to better understand what those barriers are. I'm particularly interested in stigma about diabetes. I'm really glad to see that we're finally starting to have conversations about stigma, about mental health conditions and STIs and things like that. But I'm really not seeing much about diabetes just yet. And there's definitely a lot of stigma around that disease that I want to better understand how we can overcome that. I'm also interested in patient-provider communication about diabetes. I think, that's a place where stigma can sometimes be a particularly big barrier, where there's a lot of, shaming and blaming going on between the providers and the patients. And then also just looking at the psychological complications of diabetes from a public health perspective. Diabetes is I'm sure you all know, one of the more prevalent conditions in the US right now. And there's a lot of data that shows that people with diabetes do have mental health issues like depression, anxiety, eating disorders. And so I want to understand how we can better address that from a public health perspective. Since I'm only in my first year of the PhD, I'm not yet conducting my own research on this, but I am collaborating on studies that are looking at disparities in diabetes outcomes and like social support and other things that can help people with that condition potentially live better with the disease.
And I already kind of answered this, whoops, but yeah, so I'll just reiterate, but I'll keep it short. I'm really interested in global mental health and mental health promotion in resource limited settings. So my dissertation focuses on Bangladeshi university students because what literature there is, even though there isn't that much, that focuses on mental health in Bangladesh is that there are high rates of depression and suicide, especially in university students. With such high populations, the competition is just like very fierce and it's cutthroat. So it leads to a lot of mental health problems. And there's also a low supply of people who are trained like psychologists, social workers, therapists, and psychiatrists. So I'm really looking to see if technology can be used as a tool to kind of bridge that gap. And if it's acceptable, if things like mindfulness and meditation is something that university students in Bangladesh would be willing to use, because there is a lot of stigma surrounding mental health. And so it doesn't make sense to create an app. That's what I originally wanted to do, is create the app. And it's like, no, I have to relax. So first seeing if it's acceptable, and then if it is, eventually leading to something like an app or an internet-based intervention that can help these students for free. And I'd really like to take this skill set and apply it to Syrian and Palestinian refugees who are on the move. But I think it's a common misconception that these displaced populations don't have access to phones. But phones are really their only lifeline. So before they ever flee an area, they make sure that they have a working phone. So just using technology as a tool to better people's mental health is my focus.
Very cool. So I would say my path is not as topic focused, but rather it's a lot. And I'm kind of just like surrounding myself around the idea of kind of like emerging communication technologies as well as big data, and that's kind of like where I've always been. And maybe that's kind of like the marketing side of me that's really like speaks out, or maybe it's just kind of like how I started public health. So how I got involved at first place was, I started volunteering for the Drph project as a crisis counselor. And at that time, I don't remember which year it was. At that time, it was the very first year where they launched Drph Chat, where LGBT youth could come online. They could either use their phone or they could use the computer to virtually chat with one of the counselor about any problems that they have, whether they're depressed, whether they're they experience bullying, and whether they are experience whatever familial issues that they could experience. And at that time it was very, like this idea of like that technology can be used in a way that kind of help address some of the health disparity, like when like youth growing up, like they don't have a place to, and they weren't always able to come out in a way that maybe youth can be nowadays, and many still can't. And that was a way they could reach out for help without anyone noticing that they were doing that. Like that privacy was very important for those youth, and technology advances allow that to happen. So there was and so I was really interested in that, getting deeper into it, and how can technology be used in ways that also help other type of public health issue that we're seeing around us. And that's kind of like the larger question I'm always answering, whether whichever project I'm working on. So at GW, I got to work on a number of mHealth projects that use text messaging to help pregnant women quit smoking during their pregnancy. Because again, I mean, that was a very stigmatized behavior, especially around, for pregnant women. If you walk outside and see a pregnant woman smokes, and what sort of reaction do they get from the public, and how that may shame them away from seeking help. And using a mobile phone that provides them that resources that they need to get information that they need to help them quit smoking, without having to actually interacting with certain people. And so that's kind of like what I'm doing now. And so nowadays my research focuses around looking at misinformation online and to see who are the type of people that misinformations are influencing, and how that influences their behaviors. And if there are ways from a communication science standpoint, how do we then to either, do we have to, correct those misinformation, and are there ways to prevent them from, from having those messages influence them at first place? So that's kind of like what I'm doing now.
Mm-hmm. Yeah. Nothing as fancy as these wonderful people, but similar to Shawn, mine is less sort of community specific or a topic specific, but most of my work, like I mentioned at the beginning, it's fairly multidisciplinary. But the common theme there really is health equity and racial equity. So thinking about socially vulnerable populations, however you define that particular population depends on the project itself. And then thinking about how can you advance that? So some of my ongoing projects at the moment include, for instance, actually related to this panel, one of the qualitative studies that I'm conducting is looking at first-generation students' barriers to getting into a doctoral program. So thinking about what resources do programs provide, what resources they don't provide. And I myself am a first-generation student, so that's a topic near and dear to my heart. Some of the other stuff includes vaccine hesitancy among Black transit workers. So trying occupational health lens on the particular population. And another one that I'm working on is among sex workers, and thinking about the occupational health perspective. What are the barriers and what are the policy solutions that we can offer? Because end of the day, my main sort of as far as the applied research is concerned, the key theme that I try to be intentional about is how do you quote unquote center people who are at the margins? So how do you uplift their voices? And qualitative research is one of those ways where you literally get to talk to people and think about their perspective and then bring it back to academia and practice and science and policy. So that's where sort of and a bunch of my other work is within climate change and religion, for instance, thinking about how can you what are the intersections between religious institutions and climate change and climate communication that we can tap into to push for climate action? So yeah, that's sort of the broader, some of the ideas. I'm happy to chat with you all one-on-one because I can go on and on till kingdom comes. So.
Thanks, everyone. So I think now we're going to shift gears to some attendee questions. And feel free, anyone, to jump in with your thoughts. So the first one says, I finished my MPH about 6 years ago, and I am considering a doctorate as the next step in my career. I have about 15 years work experience, and I am struggling with the choice to end full-time work to go back to school. Have any of you balanced career with doctoral studies?
So for me, before I started my PhD, I was full-time working in the field, but I decided to stop working and solely focus on my PhD when I wanted to pursue that degree. I think some of the other panelists touched on this a little bit earlier, but a lot of PhD programs do require that you be a full-time student when you participate in the program, so you're not able to balance a career on top of that. DRPHs are typically a little bit more flexible. So a lot of people are part-time DRPH students and working as well. And I think in terms of, do you recommend a PhD or DRPH for someone with significant work experience? It really depends on, what you want to do over the long term. I think there are certainly meaningful skills that you can get from both of those degrees. And it just kind of depends on what your long-term interests are. And I think having work experience, is valuable for both of those degrees for sure.
I don't have anything else to add.
Okay.
I just wanted to share that I was actually working full time and doing the doctorate full time. But I will say, in the spirit of that, this is a public health audience and we're trying to get a public health doctorate. Just prioritize your mental well-being. Can you do it? Yes. But it is going to come at some degree of cost, be it your social cost in terms of your some degree of time that you're not going to be able to spend with your friends and family and so on. And that's like a very individual decision for each person. So think about that part, that how can you balance it? Now, can you do it? Yes, of course you can do it. Then the other thing I would point out, regardless of be it a PhD or a DRPH, just keep in mind it's means to an end. It's not the end itself. So that's one of the things that I don't think we talk enough about. If I'm not wrong, there's this statistic that nearly half of people who start their doctorates never finish those. And part of that is we just dwell into that dissertation. They're this is it. No, just write it down on a piece of paper. Tell yourself that I'm going to be out of here in 3 years. Talk to the person, be very assertive, especially with your kind of experience, just tell them, I'm here. I am only going to give you 3 years. Walk me out of here. So just they say, in medical school, we used to say, what do you call the person who graduates lost in your class? A doctor. Same with a PhD. When you graduate, you're still going to have your PhD. So it doesn't matter in the end. Get it done, walk out, do good work.
That's a great point, Ans. So I'm since we are kind of a small group, if anybody wants to unmute themselves and ask their own questions and make it a little more interactive, feel free to. And I'm also okay, just still going through the questions if you prefer.
So this is Anita Balan. I'm an attendee. I've already posted my questions on chat. I'm happy to repeat the question if that's okay, or
Yeah,
I don't want to jump in front of the line. So if somebody else is ahead of me, I'm okay to wait.
No, I think you can ask your question. That's fine.
Great. Thank you. A quick question. What was the timeline that all of you had in mind in generally for preparing and submitting your applications to doctoral programs, including preparing for GRE? I mean, that may not be applicable to any of you, but if it is, what is the timeline based on your experience and research, and how many programs did you apply to? Thank you. Over.
I can start for this one. For me, when I started, for me, it was very important. And I probably would recommend that for everyone as well, especially for PhD. So Ans can speak to the DRPH process. So for me, it was very important to find an advisor that I could connect with, and knowing that their research, matches with my own interests, that, and their mentorship style is one that, I could work with. And to do so, I started to reach out to professors in the summer, the same year where I would apply, where the application deadline is usually in November, December of each year. But then I'll reach out to them, back in August, for informational interviews, just to get to know them, who, some professor would just straight out tell you, I'm not looking for a student this year. So then you'd be like, okay, I can move on. But again, that differs depending on the school you're applying to, and that may differ depending on the department you're applying to. Some school kind of does this matching process after you get in. Some of them, require you to already match with a professor going into applying. So that just kind of depends what you want to do. So GRE is kind of like, yes and no. I mean, so like GRE score does, live on for 5 years. So I think as long as, you plan for it, you take it whenever you feel like mentally sharp to take that exam and take it and make sure that you apply within 5 years, and I think you're fine. I don't think there's a specific timeline you have to adhere to in terms of applying, taking your GRE exam.
So for me, it wasn't important, partly because I knew exactly what I wanted from a particular program, and it wasn't a person specific. It wasn't, I wasn't going in to get cloned by someone. So my only thing was that, are you going to be able to follow the process and get me out of here on my timeline? But it did apply to a number of different programs. I actually don't remember right now, but I think it was at least 11 or something, partly because I could then compare offers and ask folks that no, you're going to give me full money for it. And I don't have generational wealth. I don't have white privilege. I don't have that kind of money. So you better pay for it. End of the day, I was able to sort of get different offers and then share it with schools where I wanted to go and negotiate that a little bit, that I have this particular offer. Can you expand your whatever is it that you're offering a little bit more? So all that to say that know your value, you're going to go into it, just don't forget that part that you're bringing so much that you have to offer to that school as well. So they should be able to sell themselves back to you, regardless of whatever school it is. So that was sort of a little bit on that. On GRE, I did have the privilege just because I had an MD. It was waived for me across the board, but it isn't inherently just shamelessly racist, sexist, and heteropatriarchal test itself. So in that, I think we're moving towards a world where we're hopefully not going to be requiring that racist thing anymore. So hopefully you won't have to be worrying about that part.
I agree with everything that Ans just said. I wanted to say that, so I took the MCAT to get into GW, and so I did have to take the GRE because unfortunately at that time we still had to do it. So I ended up taking the GRE the summer before I applied. I took it twice, I think, because I wanted I wanted to get into specific programs, and they have hard cutoffs for the GRE scores, and so I just wanted to make sure that I was at the top of that percentile. So I did that in the summer before applying, and then I also did my informational interviews, as Shawn did the summer before. I applied to the school that I really wanted to go to, which is UMD, the school that I'm at, early admission, which I think ultimately helped me a little bit. And I also set up an informational meeting with Dr. Carrie Green, who is my current advisor and dissertation chair, before even applying, to make sure that it was a good fit. So I would highly recommend reaching out to professors that, if you find their work interesting and you see yourself doing that type of work, to reach out to them.
And yeah, I wanted to echo something that I think Shawn said earlier, and this is also kind of answering one of the other questions that I think Emma asked about the opportunity to work with specific advisors and researchers. That was a major factor for me in pursuing a PhD and the timeline for wanting to do it. So I wanted to make sure that when I was getting a PhD, that I would be able to attend a school that had a focus on the area that I wanted to work on, as well as an advisor who specialized in that area. And so for me, deciding to go to University of Florida, one of the major factors I wanted to go there is because they have the UF Diabetes Institute, which is one of the leading type 1 diabetes research centers in the US. And that's not real, type 1 diabetes isn't like a common thing addressed in public health. So I really wanted to go to a school that specialized in that. So that was a major factor for me.
Thank you all. It's been incredibly useful. Thank you.
Thanks, Anita. Did anybody else want to ask a question before out loud or themselves?
Hello?
Feel free to unmute yourself. Okay.
Hello, my name is Roger Isom. I'm a second year PhD student at University of Maryland College Park. And I guess my question was, can you speak to any kind of like any experiences where you thought your PhD experience is going to be a certain way, and then you got in and you were surprised at things where you're like, oh, I wasn't expecting that. I feel like for me, when I was getting into my program, there were a lot of things that people were telling me about. And so I kind of had this frame of how things were going to be. And now that I'm in it, I'm starting to have a lot of different reflections and discoveries of like, my experience really can be what I want it to be. So I just wanted to know if there was anything where you guys had where you thought it was going to be X, and then you end up going into it and you're surprised of something like, oh, there's more to it than what I thought it was.
I think just to me, it was I'll keep it concise. Like it's this doom and gloom thing where like, people make it to be a far bigger thing than it actually is. So that's why I keep going back to it, the like, it's means to an end and not the end itself. So like, just like keep in mind that you're there, you do what you got to do, and then just like get out. And then like, so I mean, end of the day, it's your prerogative and whatever works for you, and we're all different, but like, I've never been asked for my transcripts like ever in actual professional life. So there were times where I just like I literally calculated my B for each of the classes. And I'm like, these 3 assignments are never gonna get submitted. Like, I don't care. I need to maintain my scholarship, and that's it. So thinking about that part, but when you go into it, like everyone is, oh, like I believe Emma's question was earlier, can you do work and do this PhD at the same time? Like often you hear that like, no, impossible. Not impossible. Again, like, you gotta be able to take a very deep, hard look at your life and think about how you're gonna manage it. So end of the day, it's just your time management. That's what it boils down to. But that was the main thing I think for me, because like almost everyone was like, there's no way you're gonna be able to do anything else but this thing. I mean, it's kind of, here I am. So it was fine. Yeah.
I should also say that I don't think Ans ever sleeps, so bear that in mind. But as for me, I think when I started the program, I kind of expected more structure to it, which wasn't really the case. Besides the coursework that you have to do for your first 1 or 2 years, a lot of it is left up to you. And I would say that you kind of get what you ask for. So I was funded going into the program. Luckily, that's not the case for everyone. Other people had to be a TA to get that funding, which you're not getting the research experience then, and then you have to use your own time to kind of carve out that experience. So I took advantage of my winter breaks by reaching out to professors, asking if they had funding for additional projects, and I think I got so many opportunities that way by like just cold emailing a lot of the professors and getting guidance from people that I wouldn't have met otherwise. So it's a lot of like taking advantage of the resources that you have in front of me, because I don't think that the resources are hard to find, unfortunately. And so you have to go looking for them and asking for them. At least that was the case I'm also at UMD. So in my department, it was the case that I would have to ask specific professors for things, because as a cohort, we weren't just given the resources.
So for me, I honestly don't think I can fully answer the question, because so much was different than how I expected it to be, because I started my PhD during the pandemic. And so I have yet to even have a single in-person class for my PhD. And so I've been having to do everything remotely. So that has definitely been a different expectation than what I had in mind, but I can definitely see what both Munjireen and Ans have been saying, and where they might be coming from on those things. I would say that it's one thing that I was very excited by was like the community that the PhD programs have. And even during the pandemic, being remote, they do a lot to try to engage with the students. And that was definitely a positive that I was not necessarily expecting. So that was valuable for me.
Emma, I think you had your hand raised. Did you have another question?
Yeah, sorry to dominate the questions here, but I'm in like a very specific life situation. I have been working full time. I did my MPH at GW while working full time, and so I'm very well versed in the experience of trying to do that. But I'm also at the point of potentially starting a family, and I'm curious if folks have balanced family and having kids while doing this as well, because that seems like a whole nother ball game and could be very challenging.
I have not personally done that. Several of the students in my program do, though, so it is definitely possible. I know that, you know, work-life balance is definitely something you have to think about when doing a doctoral degree, and I think one of the nice things about doing a PhD in particular is that you don't have like that 9-to-5 job sort of thing, so you are flexible in terms of like, or at least that was my experience. I don't have like to sit at my desk and work from 9 to 5 every day. So you kind of are flexible about when you can work on things. So you have more time to potentially spend on family matters at hours of the day that you think would be more valuable for that. But I can't really offer a personal experience, unfortunately.
Same. The only kid I have is my dog, and but I do know that it's like really challenging. And again, like I would say, can't speak for personal experience, but what I would say is that like reach out to folks and find people who you can find to be supportive of that particular thing. And I am going to be starting family during this particular time as you continue your PhD. So they're aware of it, and you know that they're going to be able to support you, because I keep going back to it. And this is not an institution specific thing. Academia generally, especially private education, is fairly unethical and sexist. So in that these systems are not very conducive to people, especially parenting people. So in that, I think like proactively reaching out to advisors and talking to them about this thing might be more conducive to that situation.
Great advice, thank you.
I'll ask one of the questions from the chat. Maybe Munjireen, you can answer this one. So I graduated from GW with an MPH in 2019, and I want to rack up some years of work experience before going back to school. What are things that you suggest I should keep in mind over these years to eventually make myself a competitive applicant? What kind of experiences should I be exploring before going back to school that would make my doctorate program experience richer?
So I feel like maybe I'm not the best person to answer this, because I only took a few months off between my MPH and my PhD. But what I tried to do during my MPH program was hone in on the topics that I was most passionate about, because I think with the dissertation, if you're not passionate about your project, it's really hard to finish. And so I would explore different topic areas and methodologies if you can. And of course, try to get some publications under your belt, because I think that can only help you in the admissions process. But if someone else wants to speak who has more experience between, that would be great.
I can jump in. I definitely agree with what Munjireen just said. And I think there sometimes are like misconceptions about like what experience is valuable and what isn't. For me, like before I started my PhD, I was not working in a research setting. So I was really doing like community engagement type of work. I did not get to do any publications in the work that I was doing. And I was actually really concerned that I wouldn't be admitted to a PhD program because I didn't have that direct research experience. But what I learned was that practice experience was also really valued in the PhD program, and that when I had spoken with several faculty members across different institutions, they found that to be something that made my application stand out, was that I had that community experience, which was something that I was thinking may actually be a negative side, but it actually was a positive. So I think you don't just have to focus specifically on research prior to starting a doctorate. You know, any kind of experience you can do in public health is valuable and gives you that, real world perspective into what health issues are happening and strategies to address them that you can later build on in a research portfolio in a PhD.
I think we have time for maybe one final question. If anybody wants to unmute themselves and ask a last question. If not, maybe I see a question that says, in addition, do you believe that publications or lack of weigh heavy in an application or preparation for your program?
Or just in general, the idea of research and publicating, is that something that you find as a core of what you do now?
So I would say it depends on what kind of career you want. If you want to stay in academics and be a professor, then I think it's always publish or perish, unfortunately. Maybe it's different for DRPH, I'm not sure. But if you want to go work for different organizations like the UN, whatever, WHO, it's less about publications and more about experience. So for me, going into the PhD program, I had one submitted publication, but nothing had been accepted yet. And thinking about the members in my cohort, I think only 2 people had previous publications. So it's not the end all be all, but I think it does help.
I think for PhD, especially like publication, for application perspective, it does help, but for the duration of it, or what is it that you're going to do at the end of it, that absolutely depends on what is it that you want to do. Like if it is the academic career, it's a dysfunctional system, but it is the system that, you keep publishing this stuff that 7 people are going to read throughout your life. And virtually no one cares, but we care so much within academia about those publications. So yeah, that really depends on what is it that you want to do after getting a PhD. For me personally, I don't care about academic publications as much. My work is more so on social critique. So it's more on commentary and thinking about that part, like uplifting some of those social determinants of health, evidence-based commentary, but really, calling people out and proposing certain recommendations that do this, do that, as opposed to publishing this esoteric stuff. So I don't have a very sanguine view of publications, if you can't tell.
Okay, so I think we're have our final few minutes together. So I want to thank everybody, all our speakers, and all these great questions. And I will pass it back to Jennifer for some final remarks.
Sure. Well, I see a few more questions coming in. I do feel bad that we weren't able to answer them. So I wonder if there's a way we could save some of these questions and then respond to them via email after the event. I'd be happy to help answer any questions that are still coming in. But I agree with Meghana. Really appreciate all of you attending this webinar, and I hope that you found it informative. I did want to put in a plug for our next webinar, which is going to be at the end of March on March 29th. It'll be an advocacy-oriented webinar led by one of our other board members on the Delta Omega chapter, Dr. Rebecca Rolston, and she will be speaking about how to write op-eds for public health advocacy initiatives. So that should be really exciting, and we'll be sending out more information about that webinar very soon. Also, as Meghana mentioned earlier, we will be soliciting applications for potential new members to join our Delta Omega chapter very soon. We're in the final stages of determining our selection criteria and application process and deadlines for new members this year. So definitely be on the lookout in your emails and on our social media accounts over the next couple weeks as we share more information about that. So I also wanted to turn it over to Sarah just to kind of close us out to speak from the GW alumni team.
Thanks, Jennifer. And thank you so much. There are several thanks in the chat, and I want to add to them. Thank you so much to each of our speakers and to Meghana for moderating. It's really valuable to hear your experiences, and I appreciate that. I want to offer from the alumni relations side 2 offers and 1 ask. There are a lot of opportunities available to alumni through GW for social or career or professional development events. And so I dropped the link to the alumni page in the chat. You have a lot of benefits as alumni. And so I hope you take advantage of some of those and check them out, especially as you continue to sort of think through your career choices. And if you're looking for some fun social events, we have a lot of those as well through alumni relations at the university. I also want to drop in the chat the link to career services. I think most of you are alumni, but also students. You have a lifelong membership to the School of Public Health Career Services team. And so if you want to talk specifically about some of these career questions that you're wondering about, that is always available to you even after you graduate. You always have access to that service. And so I hope you'll think about taking advantage of that. And finally, an ask, which is Munjireen actually mentioned earlier that you did a study and you were surprised, or did a survey, or were surprised to find the number of food insecure students in your program or in your department. And the Public Health Student Association at GW has done a similar thing and are finding quite a few needs within the student population, especially regarding kind of urgent, kind of basic necessities due to the pandemic. And so they are raising money right now for the Public Health Rapid Response Fund, which goes to meet those urgent needs like food assistance, housing, transportation, technology to log into online classes, that kind of thing. And so if you're able, I know it's a tough time for a lot of people, but if you're able to contribute any amount of money to that fundraiser, the Public Health Student Association and myself would be really, really grateful. So with that, thank you so much for attending this evening. Folks are dropping some contact information in the chat, and we'll email that out to you as well. And I hope you all have a wonderful evening.
Thanks,
Thank you, everyone.
Thank you, everyone.
Bye.